Hi, Scott Tipton. I wanted to be able to give you an update on some of the issues that we've been working on in Washington this week. I'd like to begin with something that I think that we all share, a commitment to be able to support our troops, our men and women who are in harm's way, standing up for the freedom of this country. Through the House of Representatives and through the United States Senate, we passed the NDAA, the National Defense Authorization Act, with broad bipartisan support. To be able to give our troops a pay raise, to make sure that they have the equipment that's necessary to be able to carry out the mission that we've given them, to let them know that the American people in Congress, the government of the United States, stands behind them. Those passed through both houses, again, with bipartisan support. Unfortunately, the President chose to veto that legislation, putting politics before the interests of our troops and I believe the United States as well, to be able to use that as a lever to increase spending elsewhere for government. We need to make sure that we're standing behind our troops, making sure that they do have the materials, the equipment necessary, and the resources for their families to make sure that they are providing for the defense of this country. We will be having a vote to override that veto, and I'd encourage you to contact all members of Congress to vote to override that veto, to stand behind our troops who are willing to stand up for this country. A piece of legislation that we are pleased to tell you is moving is our Taylor Act. It's to be able to address something that so many of you in our district have talked to us about, and that's access to capital. For our businesses to be able to grow, to be able to maintain the jobs they have, and to be able to create new jobs as well. The Taylor Act is going to be innovative in that it's going to actually address one of the great concerns that we see coming out of Dodd-Frank, which has inhibited capital growth and development in this country, hurting our economy. It's for small community banks and credit unions to actually have rules and regulations that are tailored to be able to meet their risk portfolio and the size of the institution. Also, it has one very unique approach that we've talked about before, getting Congress back into that regulatory mix. In this legislation, I've incorporated an automatic look-back provision after 5 years. Any rules, any regulations that are promulgated as a result of it will actually be looked at. We'll have an opportunity to be able to see if the regulators did not meet legislative intent or exceeded it. It can go both ways, but we have to be able to get Congress back into that part of the process because rules and regulations have the full effect of law. And if you want currently to be able to adjust those rules and regulations or to eliminate them, it takes that proverbial act of Congress to be able to do that. A bill through the House, a bill through the Senate, a presidential signature to adjust or to remove something that no member of the House, no member of the Senate, no Republican, no Democrat ever voted on. That's not the way the legislative process or the regulatory process should need to work. We need to be nimble like we are in small business. If something is working, that's great. But if it's not, let's fix it. And if we can't, let's get rid of it. That's what the Taylor Act is going to be bringing for our small community banks and supporting them and our credit unions as well to make sure that those resources are going to be available for not only our small businesses but for our families as well. One other bill that I think is going to be very important that we'll be voting on this Friday is going to be a reconciliation bill. Many of us have had great frustration as through the House of Representatives we've passed year to date better than 170 pieces of legislation, many with bipartisan support, my bills as an example, that have went over to the United States Senate that have yet to have a vote. They have a requirement with the 60-vote rule in the United States Senate that has inhibited legislation from moving forward and ultimately reaching the President's desk. The reconciliation vote that we're going to be having this Friday is going to be addressing something that we are now hearing in Colorado in particular is of great concern, and we've now been joined unfortunately by 9 other states as well. The Colorado Health Op is currently not going to be receiving funding out of the Affordable Care Act, and they're going to be winding it down, creating insurance challenges for many people who do need health care. As many of you know, we've been advocating for private sector solutions to be able to address this. The Affordable Care Act has not worked, frankly, in our district. We have seen our premiums go up, we have seen co-pays go up, deductibles go up, and we've seen access in rural Colorado actually going down. Those private sector solutions are going to be the best choice for us to be able to deliver what we can all agree on, affordable and accessible health care. Unfortunately, the Affordable Care Act, as it continues to demonstrate in terms of real reality at home, is failing at both of those levels, on affordability and on accessibility as well. To be able to address that, we have a complex bill called reconciliation. It has very strict perimeters which must be abided by to be able to move it to the Senate and require only 51 votes to be able to have a bill ultimately reach the President's desk. I'd like to read to you just a few of the components of this legislation, which will be passing out, I believe, the House of Representatives today. It's going to be defunding abortion providers, but then taking those same resources, bringing them back to our state, back to our healthcare clinics, which we have an abundance of, far more than the current centers that are available through Planned Parenthood, to make sure that we're delivering that healthcare and the needs in our communities. It's going to repeal the individual mandate, repeal the employer mandate, repeal the medical device tax, which is increasing costs for American consumers and driving healthcare costs even higher. Repeal the Cadillac tax, repeal the Obamacare slush fund, and repeal the auto enrollment mandate. We have plans and bills on the floor right now. Tom Price's bill, which I've co-sponsored, Putting Patients First Act, to be able to address affordability and accessibility. These are some of the underpinnings of Obamacare, which, as the CBO noted just a few months ago, is going to have increased costs to the American taxpayer to the tune of better now $1 trillion more than the original cost estimates. We need to address affordability and accessibility. We'll move this bill forward. It will go over to the United States Senate. If they can make further adjustments on it, they're welcome to do so. But we need to be putting a bill on the President's desk to address something that is a great concern to all of us. And that's not just to have an insurance policy, but to have real health care and to be able to address that. As always, we welcome your comments and your thoughts into our offices in Grand Junction, down in Durango, in the San Luis Valley, in Alamosa, and in Pueblo, and certainly the Washington, D.C. office as well. We want to be able to hear your concerns, and as we travel through our district, we fully understand that right now in Colorado we have a tale of two economies. We're seeing our urban areas do somewhat well, but we're still continued and focused on jobs for rural Colorado, the areas that I have the privilege to be able to represent where we're continuing to see challenges. Your thoughts are important to us, and we encourage you to contact us, and I look forward to seeing you soon.